So last week on the program, we talked about a gut-wrenching story from South Dakota where a nurse who is caring for COVID-19 patients describes how they are in denial of the virus as they literally die from it because they believe Donald Trump's lies. They believe that this is a hoax and that what they're experiencing, the illness that they feel, it's not from the virus. It's from something else. Now, another story has emerged featuring another nurse who's working on the front lines, caring for COVID-19 patients, and what she says is genuinely just heartbreaking. And I wanted to share her story because I think that these types of stories from nurses are really important. So she writes, "I am tired. I spent the last 8 months caring for COVID patients. I've missed my family and friends. I've missed birthdays and my own wedding anniversary. I've coded nurses and doctors who worked in the same hospital as I when they contracted coronavirus. I kept going. I believed my country needed my skills to save American lives, so I dropped everything and flew to New York. I've worked in South Jersey, Philadelphia, Pennsylvania, Chester, Pennsylvania, and now I'm back in Texas. We were making gains. The numbers were dropping. The curve was flattening. I was able to leave the COVID ICU. I was assigned to a non-COVID floor. I was finally able to go home. My toddler has stopped crying every time I leave the room because she was scared I wasn't coming back. It's heartbreaking to watch a happy child get sad because she thinks her mama is leaving again. Children don't understand their parents being gone for months at a time. We were finally settling in and getting back out to the new normal. But then Donald Trump and his followers started this anti-mask bullshit. Now our numbers are climbing again. Actually, they are worse in my hospital than the first wave. I'm going back to the COVID unit. I'm going back to a small, cold, one-bedroom apartment and leaving my home. I'm going back to an uncertain future. I'm going back, except now I'm losing hope. The worst part of it all is my little one. She is so happy that her mama is home. Now I have to leave again. I dread the holidays. Not one of these selfish anti-maskers is going to care that I'll spend my holidays alone so they can be assholes and not wear masks. They don't have to see my child's tears. They wouldn't care anyway. She won't get to eat my sweet potato pie on Friendship and Fellowship Day. This will be the first year that she's excited about our tree and the gifts under it. I'm going to miss it all. This is what I have to give up so these horribly selfish people can go to their grandma's house and infect her with COVID. Then they'll bring her to my hospital. They're not kind. They are entitled assholes who think someone else got grandma sick. They're the ones that will follow you to another patient's room to tell you their grandmother is more important than the patient you're going to see. They're the ones that will take out their air vote to blame China for the China virus. They're the ones that call me girl. They tell me how admirable it is that I speak good English and manage to overcome to get a college degree. They are racist COVIDiots and they refuse to acknowledge the harm they cause. I deserve a break. I deserve to watch my baby open her gifts on Christmas. I deserve to work without fear that today might be the day I contract coronavirus. I am fucking tired." Now, hearing this story, like the last story, it brought tears to my eyes because, in the last story, the South Dakota nurse talked about how painful it is to see, patients who she cares for in denial. But this story, it gives you the perspective of a nurse, and this just reinforces the reality that when this is all said and done, these nurses are going to have PTSD. They're going to have decades of trauma from this experience. They're putting everything on the line, sacrificing their own lives to care for people in a country that don't seem to take the virus seriously. I mean, most people do, but a large enough portion of American society just doesn't seem to care or take it seriously, thinks it's a joke. And that anyone who is taking it seriously is, being too alarmist. And then, this is the cost. It's taking a toll on the personal lives of nurses and doctors who have to give up everything to fight, and they're putting their lives at risk. I mean, this to me, it might have hit me harder than the other story with the South Dakota nurse, because, even though that's sad as well, this really just shows you that this is not an easy job. I mean, the trauma that they're experiencing is comparable to veterans of war, like what they're seeing. They're seeing their colleagues die. They're caring for patients that are saying racist things to them. It's just, it's so sad and devastating. And I've said this before, but I don't think we're truly going to grasp the scale of devastation from this virus until decades later. I mean, when there's something like 9/11, which is a singular event where 3,000 Americans die, you can easily reflect on that because it's just this one sudden shock. But, the thing about these types of pandemics is the devastation occurs at a more gradual rate. It's like, the frog that you throw into a boiling pot. If he feels that heat, he's going to jump out immediately. But if you throw a frog into a pot and then you gradually turn up the temperature, he's going to get accustomed to it. And that's what I think is happening with COVID-19. Like, as the numbers tick up, as we reach more than 250,000 deaths, people tune out. Like, the number just is too big for our minds to fathom psychologically. So I think maybe there's, some form of protection that we're imposing on ourselves by putting up this wall, or maybe we're just growing numb to it. Either way, people who are fighting this virus firsthand, like this nurse, she doesn't get to be numb to it. She sees it every single day. So it's super convenient that individuals like you and I can just try to tune it out, try to stay home in quarantine and play video games and distract ourselves. But folks like this, they don't have that luxury. And their families are suffering for this because they're choosing to fight this virus and save lives. And what do they get in return? Nothing. And this hits close to home because I have friends and family members in healthcare who are working with COVID patients. And, when I hear stories that, they're putting their lives at risk and getting exposed to the virus, it's horrifying. We're starting to see a light at the end of the tunnel because, we're having multiple vaccines show to be pretty effective, highly effective even. But how much devastation will we see before getting to that point? I mean, how many more people are going to die who are alive today who haven't yet been infected? It's horrifying to think about. So I think that these stories are important. I don't believe we should look away from this. I think we have to face this and we have to do something about this. Nurses and frontline workers are going to be absolutely traumatized for decades, and we have to take care of them. We can't just abandon them. But we live in this cold, late-stage capitalist society where, we don't look out for our own. So this was this hit close to home, and this thread was really informative. We oftentimes, if we're not in this position, don't have to think about it. But when we hear from these folks, man, is this horrifying.
So, what are some of the nursing care problems that the patient is going to present with? So, we'll look at the patient who has coronavirus to say, how can we nurse this patient using the nursing care plan? How can we nurse the COVID patient with using the nursing care plan in relation to nursing? Sorry. So you know that the nursing care plan, it has a problem, then it has a nursing diagnosis, it has a goal or aim, then it also has the intervention as well as the rationale, then it has the evaluation. So that's how about the nursing care plan. So just to give you a brief concept, when you are coming up with a problem, you need to first consider which organ is actually affected. So in this case, it is the respiratory system. And when you look at the respiratory system, of course, you have the bronchioles as well as the alveoli. All right. So if the problem it is happening inside the alveoli, you know that inside the alveoli, that is where gaseous exchange takes place. So you say the problem it will be impaired. All right. If the problem is happening along the airway, this is what you are going to call as ineffective. All right. It is ineffective. If it is along the airway, it is ineffective. But if it is inside the alveoli, you say impaired. All right. So in this case, we have a patient who has got coronavirus. What will be the problem? What will be the nursing problem? So the nursing problem that the patient is going to have, it will be impaired gaseous exchange. All right. The nursing problem you're saying it is impaired. All right. Impaired gaseous exchange. Okay. So this is one of the nursing problem that the patient is going to present with. So the nursing diagnosis, which is the table number 2. So under the nursing diagnosis, they consider these words related to or due to as well as an evidence. All right. So a diagnosis, it has these words that are very much important for you to bring them out: related to, or due to, or evidenced by. The problem, what is causing this patient to have impaired gaseous exchange, that is related to what? All right. Then the evidence, what is it that is going to show to you that the patient has impaired gaseous exchange? So let us try to write the same problem that we have, the impaired gaseous exchange. Then we see how it will actually come out. All right. So we are saying that impaired gaseous exchange. All right. Impaired gaseous exchange related to what? Let us try to use a different color here. Impaired gaseous exchange related to. So here where there is related, you can, if you don't want to use related, you can say due to. So related to what? What is causing the impaired gaseous exchange? So inside, in pathophysiology of coronavirus, please, if you haven't watched that video, find time to watch those videos. So inside the alveoli, there is accumulation of fluid. So impaired gaseous exchange related to accumulation, right? Accumulation of fluid, all right? Fluid in the alveoli, all right? So this fluid, it is the one that is causing the impaired gaseous exchange. In the alveoli, there are no fluid. So if fluid accumulates, then the patient is going to have problems or challenges with breathing. So what is the evidence that is going to show to you that the patient is having problems with breathing? Okay. So evidenced by what? So evidenced by dyspnea, all right, or you can say shortness of breath. So related to plus an evidence, these are very vital, guys, when you're writing the nursing diagnosis. So we go to the goal or aim. What is your objective? What do you want to achieve? What do you want to do? Since this patient already has the impaired gaseous exchange, of course you're not going to relieve the damage. You are going to actually improve it so that the patient keeps on improving, all right, and the gaseous exchange of the patient becomes improved. So when you're writing the goal or aim, it should be patient-centered, okay? It should be patient-centered, and it should have a time frame, okay? It should be realistic and have a time frame. So let us try to write the same impaired gaseous exchange. So the goal aim, it will be patient's gaseous exchange, all right, will be, okay, patient gaseous exchange will be improved, okay, after 30 minutes of nursing intervention, all right. Patient gaseous exchange will be improved after 30 minutes of nursing intervention. So what are the components that we have talked about? Patient-centered, of course. This is the patient, it's patient-centered. Will be, all right, plus the time frame. These are very much important. This 30 minutes is very much realistic. Alright? So that is the goal aim. Then what will be the intervention? So on the intervention, we shouldn't consider putting the patient on nasal oxygen therapy, which is on nasal flow of oxygen therapy, because when you put the patient on nasal flow oxygen therapy, that collapsed alveoli, it's going to continue collapsing and worsening and result in atelectasis. So you want to open up that alveoli which has been collapsed. So on the intervention, what do you want to do? How are you going to improve the gaseous exchange of the patient? That is the intervention. Okay? How are you going to improve the gaseous exchange of the patient? And whenever you write the intervention, make sure that you put the rationale. Alright? So if you're a student nurse, when you're writing the intervention, make sure that your intervention should start with I will. Alright? Because you're not on the words. Okay? You are in class. You are writing this as maybe in an exam. Okay? I will nurse. Okay? I will nurse the patient on mechanical ventilation. Alright? With oxygen therapy of 4 to 6 liters per minute. Alright? Why are you coming up with that intervention? You need to say the rationale. Why are you going to nurse the patient on mechanical ventilation with oxygen therapy of 4 to 6 liters? Alright? To improve. The reason why you're doing this, you want to improve the gaseous exchange. Alright? To improve the gaseous exchange. Alright? I will nurse the patient on mechanical ventilation with oxygen therapy of 4 to 6 liters per minute to improve the gaseous exchange of the patient. Alright? What else do you have to consider? Okay, what if the patient has got secretion? If the patient has secretion, what are you going to do? Okay, so you have to consider to say I will. Alright, I will suck the secretion. Alright, where are you going to suck the secretion? It's of course from the mouth and nose. Okay, what are you going to use? Using a working suction machine. Okay, using a working suction machine to prevent. Why are you sucking the secretion out? Okay, because you want to prevent aspiration of secretion. Okay, you don't want the patient to aspirate the secretion, because if the patient aspirates those secretion, the patient is going to have aspiration pneumonia. Alright, what other intervention are you going to consider? Alright, so in the next intervention I won't write I will, since you already know that you need to start with I will. What else are you going to consider? You have to consider actually what if the patient's tongue, it has rolled back, and then this tongue that has rolled back, it has occluded the patient's airway. The patient cannot breathe because of the tongue that has rolled back. And you know the tongue, it's a muscle, so it will need a maneuver for it to actually come into its own position and prevent the occlusion of the airway. So what are you going to say? So you tilt, okay, the head, and you extend the neck. Okay, if tongue has occluded airway. Okay, in this intervention you are saying that if maybe the tongue has occluded the airway, what intervention are you going to do? You are going to tilt the patient's head and you extend the neck of the patient. Okay, in order to allow free flow entry of air or oxygen, sorry. So what other intervention are you going to say under the on this impaired gaseous exchange? What other intervention? So wrap this one. Then the other intervention that you are going to consider, it is the position of the patient. How is the position of the patient? Since this patient they're having challenges with what? With breathing. They cannot be in orthopnea position or in supine position because they will fail to breathe. Okay? So you need to consider position them in semi-flawless. Alright? Semi-flawless to allow. Why are you doing this? What is your rationale for you to position them in semi-flawless? So let us say semi-flawless position. Alright? Why are you positioning them in the semi-flawless? To allow full lung expansion. Okay, so this is the reason why you are positioning them in semi-flawless. You want to allow the full lung expansion. Alright? What else do you have to consider? What other intervention? The other intervention that you need to consider, it is actually but giving them drugs. Okay, give them drugs. The drugs that are going to actually prevent those the neutrophils from releasing the proteases that are going to damage the alveolar wall cells. Okay, so these were basically some of the intervention, but there are so many interventions that you can do. So let us look at the evaluation. How can we actually write the evaluation? Okay, how can we best write the evaluation of the patient with impaired gaseous exchange? All right, so even the evaluation itself, it should be patient centered. All right, evaluation, it should be patient centered. So what would be the evaluation? It should be patient centered, and the evaluation, it should have an evidence. Okay, so we are saying that patient gaseous exchange, okay, which is this one. All right, which is this one here, patient gaseous exchange. You just bring it here. Patient gaseous exchange has been, okay, patient gaseous exchange has been, okay, has been improved, okay, after 30 minutes of nursing intervention, evidenced by, okay, what is it that is going to show, to tell you, to say the patient's gaseous exchange has been improved? Evidenced by what? Evidenced by of course you are going to see the normal respiration. All right, evidenced by normal respiration of maybe let's just say that 16 to 20 breath per minute. Those are the respiration. Okay, maybe evidenced by normal respiration of 20 breath per minute. Okay, so this is an evidence. Make sure that it is patient centered, it has been, okay, time frame as well as an evidence. Okay, these are the components you need to consider when you're writing the nursing care plan under the impaired gaseous exchange. What is also the another problem that the patient is going to present with? Okay, so another problem that the patient will present with, it is what we are calling as it is altered thermal regulator. All right, altered thermal regulator. So how is the thermal regulator of the patient being altered? Okay, so how can we write the nursing diagnosis? So the nursing diagnosis here, it will be altered thermal regulator. All right, related to what? Related, okay, related to cytokines released released by macrophages. Okay, related to cytokines released by macrophages. Cytokines like what? Like interleukin 1. Okay, another one, interleukin 6, tumor necrosis factor alpha. These cytokines, they are doing what? Okay, alveoli. All right. In the alveoli, the macrophage actually it starts releasing the cytokines. Cytokines like what? Interleukin 1, interleukin 6, tumor necrosis factor alpha. These cytokines, they stimulate, okay? They stimulate, okay? They stimulate the hypothalamus, okay? And once they stimulate the hypothalamus, the patient's going to have what? Fever. Okay, once they stimulate the hypothalamus is going to produce prostaglandin, and then prostaglandin, it is going to increase the body temperature of the patient. Okay, they stimulate the hypothalamus. So evidenced by what? What will be your evidence? Evidenced by fever. All right, evidenced by fever. So this is actually the nursing problem under altered thermoregulator. So what will be your goal or aim? Make sure your goal or aim, it should be patient-centered as well. All right, it should be patient-centered. Patient's body temperature will be reduced to within normal range. Okay, so let us try to write patient's body temperature will be, have you seen will be, and here we have will be. Patient's body temperature will be, okay, reduced to normal range of 37 degrees Celsius, okay, after 1 hour or after 30 minutes of nursing intervention. All right, so this is how you write. Patient's body temperature will be reduced to normal range of 37 degrees after 30 minutes of nursing intervention. So what happens when the patient has got body temperature? Of course, you need to consider that if the temperature of the patient is high, you are going to tape sponge the patient. Okay, you tape sponge the patient, you give antipyretic. Okay, so you consider giving antipyretic because you want to reduce the temperature of the patient. All right, so you give antipyretic, okay, such as Panadol. You tape sponge the patient. Okay, you tape sponge the patient. You can open nearby windows. You also give some drugs such as tocilizumab. Okay, you give some drugs such as tocilizumab. This drug, it is actually preventing the macrophage from releasing the interleukin 1, interleukin 6 from stimulating the hypothalamus, that is going to cause the body temperature to actually rise up. You can as well try to remove extra renin from the patient. You remove extra renin. Okay, you remove extra renin from the patient. Then the evaluation, it should also be patient centered. Okay, it should also be patient. So you need to consider that on the intervention you need to give antipyretic, okay, so that the body temperature is actually reduced. You need to tape sponge the patient. Okay, you need to give tocilizumab. The tocilizumab, it's actually preventing the cytokines that are released by the macrophage from stimulating the hypothalamus. You need to consider you removing the extra renin. Okay, then the evaluation, make sure that it is patient centered, okay, and it has an evidence. Okay, so what are some of the problems? Let's just try to write some of the problems. So I'm going to I'll lab these problems. All right, what are some of the problems? So the patient will also going to have self-care deficit, okay, because they are having fatigue. Okay, They're having fatigue. Why? Because the gaseous exchange is impaired and there is no oxygen and nutrient that is actually reaching the muscle cells. So there will be fatigue. If there is fatigue, meaning they are going to fail to do their daily living activity. So there will be self-care deficit. Then the other nursing problem that this patient will have, they will have anxiety, of course. They will have anxiety. They will be worrying. They don't know why they are in isolation. Okay, these clients are going to be isolated, so they will be worrying about, why am I in isolation? Okay, so you need to make sure that you actually you allay their anxiety. You need to allay the patient's anxiety. Then this patient, they're also at risk of they will also be at risk of nosocomial infection. Okay, nosocomial infection, because the immunity has been compromised. Okay, then this client, they are also at risk of having or developing pressure sores, especially those risk of pressure sores formation. Okay, risk of pressure sores formation, especially those clients that are confined to bed. The clients that are actually confined to bed, they are at risk of developing pressure sores formation. So thank you very much, guys, for watching this, for your time, for watching this nursing care plan for COVID-19 patient. You can please like my page on Facebook, which is Raymond Friday More. Then you can also please subscribe if you haven't yet subscribed. Thank you.